Good afternoon, everybody. My name is Adam Mayberry. I'm the lead public information officer for the Joint Information Center for the incident management team responding to the COVID-19 crisis in Washoe County. Normally, we would be assembled here in this room during times of crisis in our community, but given the unique nature of this particular emergency we are experiencing, we want to ensure that we're all protected and that we're practicing social distancing. The only individuals in this room right now are presenters, interpreters, and a few folks operating the cameras in back. Also pleased to announce to you that to our citizens throughout our region that we've launched a regional website that will serve as a hub of timely information and resources during this national and state emergency. That is www.covid19washoe.com. That's covid19washoe.com. You can also follow us on Twitter at covid19washoe. Receiving really good cooperation from our federal, state, and local partners, and want to acknowledge the tremendous support from our governor, our state leaders, and our local elected officials, Mayor Sheeby and the Reno City Council, Mayor Smith and Sparks City Council, and County Chair Bob Lucy and the Washoe County Commission. I'm going to introduce COVID-19 Incident Commander Sam Hicks in a moment. He'll be followed by Washoe County District Health Officer Kevin Dick, and followed by Nevada Public Health Lab Director Dr. Mark Pandori. After their respective updates, I will call out individually each media partner to ask their question. Please identify yourself. You will have an opportunity to ask one follow-up question as well. Having said that, I will now introduce Commander Sam Hicks.
Good afternoon. My name is Sam Hicks, and I'm the incident commander for the Washoe County COVID-19 incident. A little bit about our team. It's comprised of multi-agency personnel from various walks of life, if you will. We have Reno Fire, Sparks Fire, Incline Fire, Incline General Improvement District, and then some other folks as well from the health department that are incorporated with our team. Our primary mission is to work with the health department to organize and coordinate resources, allocation of resources if we can find them, to stop the spread of this COVID-19 and assist primarily the health department, because the bulk of the workload is happening under the health department at this time. With that, our primary focus is supporting the public and making sure that they're safe. One of the things that you've heard over and over and over again is social distancing, as well as the guidelines from CDC and the health department here in Washoe County on how we can slow or flatten the curve, if you will, on COVID. It is extremely important that you folks listen to those recommendations and adhere to them. We can only do so much. We need your help to flatten that curve. It is imperative that you follow those guidelines. If it's travel recommendations, home recommendations, for businesses that are essential, please adhere to the social distancing space so that we can minimize the spread of COVID-19. There are a lot of concerns out there with what's going on. We are working our best. We're working 7 days a week to see if we can get PPE into the area for our first responders and healthcare workers. I know that Kevin will talk a lot about the health side of it, and I'll leave that to his forte. Beyond that, we're going to be here for at least a couple of weeks to try and coordinate. We are working with the state and the federal government. When we started this process, one of the questions that may come up, and I'm going to try and head that off right now, is that how is this being paid for? Initially, every entity is bearing the cost of that. We are working on grants and funding back into the local area so that it doesn't have that as drastic of an impact as it could on the local districts and entities that are supporting this organization. That is part of the partnership that we're working with the state and the federal government. It's imperative that we work with them so that we can receive assistance for potentially funding or durable supplies that we need to get out into the field. We appreciate the businesses that have come forward and offered up supplies and services in the time of need for the community. That has drastically helped a bunch, and we really appreciate it. You've heard and seen that you can't buy hand sanitizer or disinfectant. We've had local businesses step up and offer to help us solve that problem, and that's a testament to their commitment to the community to make sure that we're safe, you guys are safe, and we can get this pandemic dealt with in a timely manner and reduce the impacts that it has on the community itself. With that, I'll turn it over to Kevin Dick with the Health Department. Thank you.
Good afternoon. I appreciate the opportunity to speak with you today. I'm Kevin Dick. I'm the health officer for the Washoe County Health District. I'd like to provide an update. At this point in Washoe County, we've had 50 confirmed cases of COVID-19. I'm happy to report that 4 of those 50 cases have recovered and have been released from isolation. But I'd also like for you to understand that we expect for that number of cases to continue to increase over the next few weeks. And that's why it is so important that we all follow the direction that we've received from Governor Sisolak as far as closing all non-essential businesses and staying home for Nevada. This is part of our strategy for flattening that curve. We have a curve of increasing cases. At some point we'll hit an apex and then those cases will go down. We want to try to flatten that out so we have less of an impact on our healthcare providers as we're seeing those increasing cases. The only way that we'll be successful with that is for everybody to pull together and work together to stay home whenever you can, to be isolated, to only go to work if you are an essential worker in one of those essential businesses. To make sure that everybody is practicing the precautionary measures of washing your hands frequently and using hand sanitizer, staying 6 feet away from other individuals to avoid contact and potential droplet transmission if people are coughing. Cough into your sleeve as well. And certainly if anybody has symptoms, even if you're an essential worker, please do not go to work, and employers, please work with your employees to ensure that they are not coming to work if they're symptomatic. We are working with our local jurisdictions and numerous regional partners, including our hospitals, and working with them to prepare for a potential surge in people seeking medical care as we have more cases occur in the community. But I'd also like to ask everybody in the community to please not go to the emergency department unless you are having a medical emergency where you need that emergency help. We have a call center set up. It is at 328-2427. That's a number that you can contact if you have symptoms, if you are concerned that you may have been exposed to COVID-19. Of course, you can also contact your healthcare provider. I encourage you to do that by phone, but you can call our number and we have a screening protocol to help understand what risk you may be at potentially for COVID-19 exposure. And that's also the number that's used to, as we do the risk assessment, to prioritize who we would test for COVID-19. I can tell you that this number now is operating 24/7 through a partnership that we have with REMSA, where we are handling calls during the day, and those calls continue through the night with REMSA's Nurse Health Line providing assistance to those individuals. Commander Hicks mentioned the need that we have for personal protective equipment, and I want to encourage businesses or others that have unused supplies to call 311 where they can be connected with the group that is accepting these donations. So that's personal protective equipment in particular. We have a need for N95 masks, gloves, gowns, face shields, and eyewear. I'd like to thank Commander Hicks and our regional partners for all of the support that is being provided to the Health District through our Regional Incident Management Team. And I'd also, at this point, like to turn it over to Dr. Mark Pandori with the Nevada State Public Health Lab.
Thank you, Kevin. Since February 11th, the Nevada State Public Health Laboratory has had the ability to perform testing for COVID-19 disease. The test that's performed at the Nevada State Public Health Laboratory is the test that was created and distributed by the Centers for Disease Control in Atlanta. Since making the test active on February 11th, the Nevada State Public Health Laboratory has performed over 1,900 tests on individuals. Our current capacity for testing has risen to over 400, the ability to perform over 400 a day through specialized training and aggressive acquisition of supplies at our laboratory. While we retain a high capacity to be able to perform this test at the Nevada State Public Health Laboratory, I would like to remind everybody that testing must be ordered through a clinician, that is a medical provider, or the health district itself. You cannot come to the lab and we can't give you a test that way. It must be ordered by a medical professional or ordered through the health district. Thank you.
Okay, thank you, Dr. Pandori. Adam Mayberry back. I'm going to call out some media outlets in order of television, followed by radio, followed by our print media partners for one question and a follow-up. And we'll have the respective presenter address your issue. We'll begin with KTV and Channel 2. Can you hear us? Again, I'm going to ask Channel 2. Are you on the air? Can you ask your question? We may be having some technical difficulties at the moment. Just please stand by as we troubleshoot this.
Why don't you rotate to the podium and ask your question from the podium? Or step to the next media group.
Let me see if we can have...
Go into the mic, yeah, they're saying.
Do we have a question from KTV and Channel 2? I know they had indicated that they wanted to participate. We may be experiencing some sound issues. Is there a question from KRNV Fox 11? KRNV Channel 4 Fox 11?
Hey, Adam. Yep, News 4 here.
Okay,
Can you
good.
hear us?
Thank you.
Awesome. I guess at this point, we're just kind of wondering, Kevin mentioned we've had 50 cases so far, 4 have recovered and have been released from isolation. What's the process for that? How does that work? How do they know that they're recovered and can be released?
Thank you for that question. For each of the individuals that are confirmed with COVID-19, our epidemiology staff work with them as they recover, and so we are kept appraised of their condition through that process. So our criteria for people to be released from their COVID-19 isolation is that it be at least 7 days after the initial onset of symptoms, and that they be 72 hours after recovering with a fever, without a fever for those 72 hours. So once they get through that 3-day period after and have recovered, and it's more than 7 days after they initially came down with their symptoms, then they're released from isolation. And that's guidance that we have from CDC and through the state.
And just sorry, as a quick follow-up question, once, and this might be silly, once somebody has recovered from this, are they possible to get ill again?
The understanding that we have is once an individual has recovered, then they should have resistance to COVID-19 for some period of time after that recovery, but we don't know at this point how long that remains. So while you have these antigens from having COVID-19 and recovered from it, we don't have scientific studies of how long that resistance lasts into the future.
Okay, thank you for your patience, everyone. We're going to go back to Channel 2. I understand they're on the line, KTV and Channel 2. Do you have a question? Okay. We'll go to KOLO Channel 8. Do you have a question? KOLO Channel 8 on the line?
Can you hear me?
We can now,
Adam,
yes.
can you hear me?
Yes, thank you.
This is Stanton Tang at Colo TV. My question is, I understand we have patients from Mono County being treated at Washoe, and that the Washoe 50 count is just the county residents who have been diagnosed. How many total patients do we have being treated in our area?
This is Kevin Dick, District Health Officer. I'm afraid I don't have a tally of patients that have been transported in for treatment in our hospitals from outside of the county. So I can't provide you with a total count on that, but I'm sure that we can work to try to provide that statistic.
Is there a representative from our Latino station here in Northern Nevada, Univision? Okay, we'll go back to Channel 2, KTV and Channel 2 on the line. Okay, we'll transition to our radio partners. KKOH, you have a question? Do we have a representative from KUNR?
Hi, this is Bree Zender from KUNR. Can you hear me?
We can, thank you. Go ahead.
Awesome. So in terms of COVID-19 collection kits, the ones that are used to collect samples, how many do we have in the county and how long is that going to last us through?
This is Kevin Dick. I'm the District Health Officer. I can tell you that as far as the health district goes, we had 355 of the sample collection kits as of this morning. And we are also working with Dr. Pandori and the Nevada State Public Health Lab. We have some additional swabs that we have received, and the Public Health Lab has the additional media we need for the viral transport media and the tubes that we need for the kits. So we're coordinating with the lab to have those swabs and their materials put together into collection kits, and we believe that that will provide us with good capacity moving forward as far as our sample collection. We do collect the information from hospitals on their supplies through our medical coordination. That inventory is not public information, and I don't have that information at my fingertips now.
I have a quick follow-up. At this point, has the criteria for getting a test for the district changed at all? And if not, is that something you're considering?
So the criteria that we have really is continuing to be a risk-based assessment and prioritizing the individuals for testing. So some of those priorities would include people that are case contacts of known COVID cases that develop symptoms, people that are healthcare providers, EMS, law enforcement that have been in contact with COVID cases, as well as in the hospital environment, hospitals sampling for testing for some of their severely ill patients.
Thank you.
Thank you. I do have a question from Channel 2. They were unable to voice their message in. This is from reporter Valentina Bonaparte. What should you do if someone in your home tests positive or has COVID-19 symptoms, and how do you protect other members of your family?
So the Kevin Dick, health officer, the question is to do with how do you handle it if somebody in your home, your household is diagnosed with COVID-19. And our staff will work with you on that isolation plan for somebody to be isolated in your home. That would involve having them isolate in a bedroom would be the preferred approach to this with their own bathroom. And then there would be directions on how other individuals in your household would interact with them as far as being able to provide them with meals, supplies, et cetera. But that's guidance that we have available, that we work with individuals if they're confirmed with COVID-19. They're individuals and households. Thanks.
Thank you, Kevin. Thank you. Capitol Public Radio, do we have a representative from Capitol Public Radio on the line? Okay, we're going to go back. We're going to go to our print media partners, starting with the Reno Gazette-Journal. Marcella, I think you had RSVP'd. Are you with us?
Yes, I'm
Thank
here. Can you hear me?
We can. Thank you. Go ahead.
So my question is, what kind of equipment is being requested through the COVID-19 Washoe Incident Management Team, and what is being denied?
Good afternoon, Sam Hicks again. There's been requests for water, portable showers, hand washing stations, obviously the test kits, PPE, disinfectant, hand sanitizer. We are also looking at alternative housing sites to fit the needs based on health department criteria. We're in the working phase of that at this time. The PPE obviously is one that's been denied, and it's not necessarily been denied. I don't want to say that orders have been denied. That gives the wrong connotation. The orders have not been filled because we can't find the materials to fill the order or something that's compatible and meets the needs of the order. Any follow-up question?
No, I don't think so.
Thank you.
Continuing down our print media partners, this is Reno. Are you on the line? This is Reno. Do we have a representative from the Nevada Independent? Are there any representatives from Southern Nevada? Okay, there is. Thank you. We have a question from Colton Lockhead with the Review Journal. This is in Las Vegas. Are you considering any spaces or facilities that could be used as field hospitals or additional medical purposes, similar to how New York City is using the Javits Center? Okay.
Kevin Dick, Health Officer. Yes, we're coordinating with our hospitals for surge capacity, and we work with our hospitals regularly over the years through our Interhospital Coordinating Council to work with them on preparedness for different types of public health emergencies. We do have an alternative care site plan that we're looking at as different alternatives for care sites for implementation. Currently, the hospitals, though, are also focusing on how they can best utilize space within their existing facilities to be ramping up with their surge capacity within their four walls that they have now. So we've got several sets of plans for how we would do this moving forward. I'm not going to identify any particular sites at this point.
Thank you. I want to take this opportunity to open it up for any further questions from our presenters. We have Incident Commander Sam Hicks, who's managing the incident management team and responding to the crisis here in Washoe County region. Our Washoe County Health Officer, Kevin Dick, is with us, and Dr. Mark Pandori, Director of the Nevada State Laboratory. Any questions from our media partners, final questions for any of them?
Hi, I have a question. This is Bree Zunder from KUNR. I know it was mentioned that PPE, the request for PPE is not filled. Can you be a little bit more specific about what kind of PPE?
Sam Hicks again. The specific PPE that I've seen orders for that have gone unfilled are N95 masks, gloves, gowns. There's some face shield type masks that have also been unfilled that meet the criteria for blocking out the COVID-19 virus.
Thank you.
I do have a follow-up question from our news partners with Channel 2. Where do I find the guidelines on how to properly self-isolate? And should I call the number given by the health district, or is it online? Kevin, if you can address that.
The guidance for self-isolation, I know, is available on the National CDC website, which is cdc.gov. And if you go to the COVID page, you'll see information for households prominently there. I'm looking at our PIO, whether we have that on our website. We will get that posted on our website, but I know you can find it currently live on the cdc.gov website, and we'll have that up this afternoon on our website.
I have a follow-up question.
Go ahead.
Based on the data that you have now, when are you expecting a surge?
We don't know.
And I'm sorry, can you kind of describe what you mean by, or what a surge would look like?
So the surge would be as we have additional cases of COVID-19. There's going to be some segment of those cases that are more severe and people require hospitalization. So I think what we've seen to date is roughly 80% or so of the cases that occur, people are able to recover and they're not severe cases. And the other 20% may reach the severity where people require hospitalization. So as we experience an increasing number of cases, as we expect to here in Washoe County, we know from that we will have more individuals that will need to seek medical care in the hospitals for their COVID-19 recovery. So that's the surge that we're talking about. As far as when that's going to happen, I can't tell you at what point we're going to be hitting the peak and having the most cases, at what point we're going to see that significant rise, but we're expecting to see a continued increase over the next few weeks of cases, and so with that we're anticipating and planning for that surge. But again, the call for action for everyone is to do your part to social distance yourselves, to stay at home for Nevada when you can, and do everything that you can do to try to prevent that disease transmission in our community. That will help reduce the number of cases, to flatten that curve, so that our hospitals have the best chance of being able to provide that care to the people that do need it.
What kind of increases are you expecting? Sorry, I keep.
I don't have a number to give you. This is something that's evolving from day to day, and so we're watching how these cases increase, and our hospitals are planning for several different scenarios.
Thank you. I do have a question for Dr. Pandori. This is from our news partners with KTV and Channel 2. When will Nevada start testing on its own, and what's the time frame for that?
Mark Pandori, Nevada State Public Health Laboratory. Nevada has been testing on its own since February 11th. As I said, at the Nevada State Public Health Lab in Reno, we've performed over 1,900 laboratory tests. So you might be referring to the regulatory relief offered by FDA, which is that the state of Nevada can ascertain the quality of lab tests on their own or lab test components. And that began last Friday. Thank you.
I'm going to ask Incident Commander Sam Hicks to come up to the podium and provide some closing remarks. Again, this is a work in progress for us, these virtual press conferences, so we appreciate you working with us, and we'll iron out any difficulties and smooth this process out going forward. So thank you for your continued support. Your service to our community is very valuable. Incident Commander Hicks.
A couple of closing comments. I want to thank the Health Department, Kevin Dick. We are integrated and working really well together. I also want to thank Dr. Pandori. This is a nationwide event here, something that nobody's seen before or had to deal with. And it's going to take everybody to get through this. And when I say everybody, I mean everybody that's at home, everybody that's at work, us, the entire community. It is imperative that you practice your social distancing and spacing, please. For us, for your neighbors, for your friends, for your kids, your grandparents. That's what's going to flatten that curve so that we can slow this thing down. It's going to be here. It's like SARS or MERS and some of the other ones we've had in the past years. It's still around. If we can flatten that curve, it will give the doctors and scientists time to deal with this and figure out what is the best way to handle it. But we cannot flatten that curve if you don't practice the social distancing. Use the CD website for information. Use the 311 for information. Use Washoe County COVID-19. We are working diligently to get as much information out to you as we can so that you're all as informed as possible. Lastly, I would say that I've reached out to Washington, to the incident commander that's up in Washington, to see what they're facing, how they're dealing with things, and they may have ideas that'll help us. So we're not in this alone. We are reaching far and wide. But again, please practice your social distancing. You've heard it from the governor. You've heard it from me. You've heard it from Kevin. It is imperative that you practice this spacing so that we can flatten that curve. That's our goal. Spread the information on social distancing. I would like to see the information on how to protect yourself, the CDC guidelines, the Washoe County Health guidelines on this COVID-19 spread faster than COVID. That's our goal. Spread the information for safety faster than COVID, and we will flatten that goal or that line. Thank you. Have a good day.